Good morning. Am I audible? Sorry, good afternoon. Am I audible?
Hello.
Yes, ma'am.
Okay. So today we'll start with next disease, that is vitiligo or leukoderma. We have already seen the histology of skin, normal skin. Here you can see the histological image of vitiligo skin. You can see the absence of melanin, where disappearance of melanocytes and interruption of production of melanin is happened. Here are some melanocytes and melanin. But in the part of white patch, there is the absence of melanin. Before seeing what is vitiligo, we'll shortly revise what are melanocytes and melanin. So melanocytes are special cells in our skin that specialize in making a molecule called melanin. So melanocytes are the special cells in our skin that specialize in making a molecule called melanin. But what is melanin? Melanin is something called a pigment, which is the molecule that gives our skin color or a darker shade. Melanin is something called a pigment, which is the molecule that gives our skin color, usually a darker shade. So what does melanin actually do? So this melanin protects our skin from the damaging ultraviolet rays from the sun. Going in the sun, the tanning induces your body to produce more melanin, which is why people who return from tanning look darker. More melanin in the skin is the reason why people who are darker usually do not gain sunburn. So what does melanin actually do? Melanin protects our skin from the damage of ultraviolet rays from sun. When we go to sun, the tanning induces your body to produce more melanin. Due to that, the tanning looks darker. More melanin in the skin is the reason why people who are darker usually do not get sunburn. Then melanogenesis. The steps in melanogenesis. First is there is the formation of melanoblast, then melanocytes, and finally melanin. In this process, phenylalanine converts to tyrosine. So the color of the rays is depending on rate of melanin production. So this is the melanin life cycle. So first is melanocyte activation. How it activates? Due to sun exposure, due to inflammation, in pregnancy, aging. After activation, there is a formation of melanosomes. So melanosome development. This is the formation and maturation of melanosomes. After that, from melanosome, there is a melanin production. The tyrosinase mediated synthesis of melanin. Then it leads to melanin distribution. So this distribution of melanosomes to neighboring keratinocytes. And at the last, melanin removal. The exfoliation of melanin containing keratinocytes. So this is melanin life cycle. How it forms. First, there is a melanocyte activation due to sun exposure, inflammation, pregnancy, aging. Then melanocyte activation causes formation and maturation of melanosomes. These melanosomes produce melanin. And after that, melanin distribution occurs. And after that, melanin removal, last stage. That is exfoliation of melanin containing keratinocytes. So what does this actually mean? So in our skin, we all have around the same number of melanocytes, which are the cells which produce melanin. However, the melanocytes in each of our bodies produce different amounts of melanin. The more melanin you have in your skin, the darker your skin color will be. So what happens in vitiligo? So first, the origin of word vitium or vitellius. The vitiligo word originated from the words vitium or vitellius. Vitiligo can appear at any age. Usually, first appears between ages of 20 and 30, but it can appear at any age. White patches may begin on face, above the eyes, on the neck, armpits, elbows, genitals, hands, or knees. One to 200 of the world population develops vitiligo, and it affects both genders and all races equally. So origin of the word vitiligo is from the words vitium or vitellius. Vitiligo can appear at any age, but usual age of appearance is 20 to 30. These white patches may begin on face, above eyes, neck, armpits, elbows, genitals, hands or knees. 1 to 200 of the world population develops vitiligo, and it affects both genders and all races equally. It is the skin condition that can manifest after birth at any point in someone's life. It leads to death or loss of function of the melanocytes in the body. which leads to the inability to produce any more melanin in the skin. Vitiligo is very visible on someone with a very dark complexion due to prevalence of white patches on the skin. So vitiligo, it is the skin condition that can manifest after birth at any point in someone's life. It leads to the death or loss of function of melanocytes in the body, which leads to the inability to produce any more melanin in the skin. And it is more visible on someone with very dark complexion. Then it is a chronic skin disease, and its other name is leukoderma. The white spots occur when the skin no longer forms melanin. The white patches of irregular shape begin to appear on the skin. Any part of the body may be affected. The common sites are exposed areas, that is face, neck, eyes, nostrils, nipples, navel, genitalia, some body folds like armpits and groin, sites of injuries like cuts, scrapes, burns, and around pigmented moles. The vitiligo patch, which is around pigmented moles, it is called as halo nevi. You can see in the image, halo nevi. So any part of the body may be affected. Common sites are exposed areas like face, neck, eyes, nostrils, the nipples, navel, genitalia, body folds like armpits, groins, sites of injury like cuts, scrapes, burns, and around the pigmented moles. It is called as halo nevi. Then symptoms and signs. White patches of skin, whitening or graying of the hair on the scalp, eyelashes, eyebrows, or beard. The graying of the hairs is called as leukotrichia, which is seen segmental. You can see in the second image, the segmental graying of the hair called as leukotrichia. Loss of color in the tissues that line the inside of your mouth. So symptoms and sign, it causes white patches of the skin, whitening or the graying of the hairs on scalp, eyelashes, eyebrows, or beard. The segmented graying of the hair is called as leukotrichia. And loss of color in the tissues that line the inside of mouth. The degree of pigment loss can vary within each vitiligo patch, which means that there may be different shades of brown in the vitiligo patch. This is called as trichrome. A border of the darker skin may circle an area of light skin. This degree of pigment loss can vary within each vitiligo patch, which means that there may be different shades of brown color in the vitiligo patch. And this is called as Trichrome. A border of the darker skin may circle an area of light skin. See in the image. Trichrome vitiligo, localized chalky white discoloration with pigmental interface between normal and depigmented areas. See the different shades of brown pigment. Then in short symptoms, white spots that develops into white patches of the skin that looks different from the rest of the skin. Initial appearance of the patches is slightly pale that along with time grows whiter and whiter because of loss of melanin pigment from the skin. An initial size of the patch can be as small as a dot that can grow larger to form a large size patch. Then types, there are main two types, localized vitiligo and generalized vitiligo. In localized, there are three types, focal, segmental and mucosal. And in generalized, acrofacial, vitiligo vulgaris, vitiligo universal and mixed type. So in localized, first is focal, one or more macules with casual distribution. Unilateral, one or more macules are localized in unilateral body region with dermatometric distribution. And mucosal, unique involvement of mucous membranes. Then in generalized type, vitiligo vulgaris, that is presence of scattered stains extensively disseminated. Acrofacialis, patches are localized on distal extremities and face. And mixed is coexistence of acrofacialis plus vulgaris. And in universalis, depigmented lesions completely or almost completely cover the skin surface. That is more than 80% of body surface is involved. Then in short again, focal vitiligo, it is one or more macules appear in area of body. Segmental vitiligo, one or more macules appear along the dermatome or quasi-dermatome. Mucosal vitiligo affecting only mucous membranes. In generalized type, acrofacial means patches appearing on peripheries of extremities, that is distal extremities and face. Vitiligo vulgaris, widely scattered depigmented patches. And mixed vitiligo, combination of segmental and acrofacial or vulgaris. Universal type, complete or nearly complete depigmentation of entire body. That is more than 80% of body surface. Then see the common sites. In some association with other things. Like premature graying of hairs in relatives. We can get the history. Premature graying of hairs in relatives. Then Koebner phenomena. What is Koebner phenomena? It is the lesion appears at the injury site. Means there is a history of injury at the same spot. So it is Koebner phenomena. Then there is a history of emotional or physical stress, or the history of drugs like chloroquine and clofazimine. So there is a history of premature graying of hairs in relatives, positive Koebner phenomena, that is the patch appears after injury. Then there may be history of emotional or physical stress, or the drugs, history of drugs like chloroquine and clofazimine. Then some systemic association. When there is an increased risk of autoimmune diseases like thyroid disease, Hashimoto's or Graves' disease, Addison's disease, pernicious anemia, insulin-dependent diabetes, and alopecia areata. So when other autoimmune diseases are present, there is also increased risk of vitiligo. The other autoimmune diseases like thyroid disease, that is Hashimoto's or Graves' disease, Addison's disease, pernicious anemia, insulin-dependent diabetes, alopecia areata. Also some eye disorders like uveitis, depigmentation of choroid, ear disorders like auditory problems. Then psychological impact. Feeling of stress, embarrassment, and self-consciousness, perception of discrimination, low self-esteem, and disturbed sexual relationships. So it has some psychological impact like feeling of stress, embarrassment, self-consciousness, perception of discrimination, low self-esteem, disturbed sexual relationships. Then there are some etiological theories. What is the cause of vitiligo? Some theories like familial theory, autoimmune theory, autocytotoxic theory, neural theory, and self-destruction theory. So there are some etiological theories to find out the cause, like familial theory, autoimmune theory, autocytotoxic theory, neural theory, or self-destruction theory. So we'll see one by one. So first one is familial theory. Epidemiologically, 25 to 33% have family members with disease. Then there is a, if there are close biological relatives, then 4 to 5 folds increase risk. Then HLA studies have variable results. HLA is human leukocyte antigens, and no specific genetic pattern is seen in vitiligo patient. So in familial theory, the epidemiologically 25 to 33% have family members with the disease. If there are close biological relatives, 4 to 5 folds increase risk of developing vitiligo. Some HLA studies have variable results, and no specific genetic pattern is seen in these patients. Then autoimmune theory, antibodies against melanocyte surface antigens correlate with the extent of depigmentation. So there is a formation of antibodies against melanocyte surface antigen, which is correlating with extent of depigmentation. Anti-tyrosinase antibodies, anti-melanin antibodies, and melanin sensitized lymphocytes are present. Leukocyte migration inhibition factor levels and circulating immune complex levels markedly elevated in these patients. Autoimmune theory. What is autoimmunity? Means there are formation of antibodies against our own cells. So here is the formation of antibodies against melanocyte surface antigens, which leads to the depigmentation. Formation of anti-tyrosine antibodies, anti-melanin antibodies, and melanin sensitized lymphocytes. These leukocyte migration inhibition factor levels and circulating immune complex levels are markedly elevated in these patients. And this is the diagram of cellular and humoral immune mechanism of vitiligo. These are the normal melanocytes, and some antibodies form against these antigens, melanocyte antigens, which damages or causes destruction. This is damaged melanocyte. Then autocytotoxic theory. Here there is an increased melanocyte activity leads to its own demise. Inhibition of thioredoxin reductase by calcium. So higher calcium levels causes increased superoxide radical formation, and which leads to the increased melanocyte activity. Levels of catalase are markedly decreased. Autocytotoxic theory. It means here is increased melanocyte activity which leads to its own demise. inhibition of thyroredoxin reductase by calcium. So this higher calcium levels causes increased superoxide radical formation, and which leads to the increased melanocyte activity. In these cases, levels of catalase is decreased. The neural theory, it is based on some following observations, like patients with nerve injury and vitiligo in denervated areas. Patients with nerve injury and vitiligo in denervated areas. Also, there is a clinical evidence of segmental dermatomal vitiligo. Clinical evidence of segmental dermatomal vitiligo. Also, there is an increased sweating and vasoconstriction in vitiliginous areas. So this is neural theory, means based on nerve injury. So patients with nerve injury and vitiligo in denervated areas, clinical evidence of segmental dermatomal vitiligo, and increased sweating and vasoconstriction in vitiliginous areas. In neural theory, depigmentation in animal models with severed nerve fibers is seen. Degenerative and regenerative autonomic nerves in depigmented patches, and increased urinary secretion of VMA and HVA in active vitiligo. Meeting will end in less than 1 minute, so you can rejoin again. The last theory is self-destruction theory. The last theory is self-destruction theory. It suggests that melanocytes are destroyed by flaws in the protective mechanism that removes the chemical toxin that is generated in melanogenesis. So this theory suggests that melanocytes are destroyed in the protective mechanism that removes the chemical toxin which is generated in melanogenesis. So here are some triggering factors with molecular level changes and some genetic factor. Triggering factor for vitiligo are nutritional deficiency, emotional stress, drugs, infections, focal sepsis and toxins, exposure to chemicals, and oxidative stress. The triggering factors are nutritional deficiency, emotional stress, drugs, infections, focal sepsis and toxins, exposure to some chemicals, and oxidative stress. These drugs causes biochemical changes. Infections causes enzymatic disturbances. Focal sepsis and toxins causes autoimmunity and immune dysfunctions. And oxidative stress causes epidermal hydrogen peroxide accumulation. Then genetic factors. Due to genetic factors, the normal skin can go to pre-vitiligo, but it can be reversible. Then pre-vitiligo can lead to vitiligo. In some cases where there is only localized or segmental patches, we can reverse the vitiligo also. So these are in short triggering factors or some causes like antibodies formation against melanocyte antigens, environmental triggers and stressors, T-cell activation, imbalance of epidermal cytokines, oxidant stress and antioxidant imbalance, melanocyte detachment, decreased melanocyte growth factor, defect in calcium uptake in keratinocytes and melanocytes, and decreased zinc alpha-2 glycoproteins. All this leads to vitiligo in genetically predisposed patient. Then medical screening, a family history of vitiligo. You have to see if there is a rash, sunburn, or other skin trauma that has occurred within 2 or 3 months after pigmentation was discovered. Also, you have to see premature graying of hairs before age 35, or there is any stress or physical illness. Also see for eye examination, that is inflammation of eye, or blood test for autoimmune diseases like HLA antibodies. Then histopathology. Histopathology of vitiligo skin. So there is a uniform absence of melanocytes. Periphery of depigmented patches show signs of cellular death and dilatation of rough endoplasmic reticulum in melanocytes and inflammatory changes in dermis. What histology shows? Histopathology shows uniform absence of melanocytes. Periphery of depigmented patch show signs of cellular death. Dilatation of rough endoplasmic reticulum in melanocytes and inflammatory changes in dermis. And how to evaluate? Total body Wood's light examination means whole body is examined for patches. Then we should check for TSH levels for any thyroid diseases. We should check for CBC, for pernicious anemia, evaluation of diabetes mellitus, and ophthalmological examination. Then treatment. There are mainly 5 types of treatment. Cosmetic. Second is PUA, that is Soralen plus ultraviolet irradiation. Soralen is a drug. So that drug plus ultraviolet irradiations. It includes topical and systemic treatment. Third one is corticosteroids. Fourth is surgical treatment. And last one is monobenzyl ether of hydroquinone. So treatment includes 5 types. Cosmetic treatment. Second one is PUA, Soralen plus ultraviolet irradiations. It includes topical and systemic treatment. Third one is corticosteroids. Fourth is surgical treatment. And last one is monobenzyl ether of hydroquinone. So first is cosmetic treatment. Patches on exposed part can be concealed by makeup brands like Covermark, Dermablend, Dermacolor, etc. Topical dyes can be used, that is Clinique Bronze Gel, Vita Dye, Diodome, etc. Tanning creams can also help, like Chromelin and self-tanning milk, etc. Advantages of this cosmetic treatment is it has less cost, ease of application, and lack of side effects. There are some disadvantages also, like when we do vigorous physical activities, so these creams or these dyes cannot effect. Also in extensive disease or like universalis vitiligo or generalized vitiligo, we cannot apply all these cosmetics. So this is cosmetic treatment. Then PUA. Soralen plus ultraviolet A radiation. Historically, Egyptians in 13th century started this treatment. That is the herb they used, Amimajus linnaeus or amioidine, 8 MOP, 5 MOP and 8 isoamylin OP. These are the names of drugs. In 1904, Montgomery light therapy in vitiligo was used. In 1948, Ulmofty, first use of light therapy in combination with Soralen. So this PUA therapy is available since 1948. So initially, Egyptians started the treatment in 13th century with the herbs like Amimagus linnaeus, Amoidin 8-MOP, 5-MOP, 8-isoamylinop. In 1904, Montgomery light therapy in vitiligo was started, and in 1948, at Ulmofty, first use of light therapy in combination with Soralen was started. So what is the mechanism of action of this PUA therapy? That is Soralen plus ultraviolet A radiation therapy. It causes immunological mediated action. It stimulates tyrosine activity. There is an inhibition of DNA and protein synthesis, depletion of EGF expressions, and depletion of vitiligo-associated melanocytes antigens. So this PUA therapy causes immunologically mediated action. It stimulates tyrosine activity. It inhibits DNA and protein synthesis. It causes depletion of EGF expressions. It also causes depletion of vitiligo-associated melanocyte antigens. How melanocyte repigmentation? Activation of inactive cells which are spared in vitiligo process in the middle and lower part of follicle and in outer sheath. This PUA causes activation of inactive cells which are spared in vitiligo process in the middle and lower part of follicle and in outer sheath. These inactive cells contain structural and melanosomal proteins, but these do not contain enzymes which are required for melanogenesis. So these inactive cells are activated by this therapy. Then migration of melanocytes from lower hair follicles to epidermis depends on cytokine release like FGF, interleukin-1, inflammatory mediators such as TGF, tumor growth factor alpha, leukotrienes, C4, D4, and endothelin-1. So after this PUA therapy, this migration of melanocytes from lower hair follicle to epidermis depends on cytokine release and release of inflammatory mediators. So next part will continue in next lecture tomorrow. If any doubt till here, you can call me or message me personally. Thank you. You can leave the meeting.